So you wanna be a nurse someday? Well, whoop-de-doo.
Loran!
I have been around the block before with blockheads just like you.
I wanted to take some time at the beginning of this video to just welcome all my new subscribers and to thank everybody who watched my videos. In the last couple months, I got over 100 subscribers, and I never thought that would ever happen. That's just amazing to me, so thanks so much. Nurses Week was last week, so I wanted to continue my series called Nurse Life, where I discuss multiple issues that nurses deal with. The first video in that series was talking about circulating nursing and what I do in the operating room. I'm gonna put a link right about here for you to check out. And on the video, I received a question that I've had to deal with a lot, and I thought I would answer it today. Amanda H. writes, "What's your thoughts on a nursing career? I've been thinking about going into it, not sure what specialty I'd like yet, but I always read all these negative things online about nursing and it's discouraging. What are your thoughts on it? Any regrets?" Oh, Amanda, let's break this down. Nursing is one of the most difficult jobs that somebody could have. It is highly demanding, physically, emotionally, psychologically. So what do people do when they're in a stressful situation? They end up venting, and a lot of people don't understand where that anger and frustration is coming from. So I'm not surprised that you heard a lot of negative things about nursing. So here's what I've discovered is that when people are saying, should I become a nurse? Do you regret becoming a nurse? They are asking the wrong question. The question they should be asking is, do I have what it takes to become a nurse? So that's what you should be figuring out right now, is more so self-evaluation and seeing, are you best suited to be a nurse or something else? So Amanda, I thought I would share with you 5 things that I think are vitally important for every nurse to have. First off, I think you should have a scientific mind. Were you that kid who was always wondering how something worked or why something worked? You're gonna find that in the nursing program, that's gonna be a lot of what you're gonna be learning, especially in your first class, that's anatomy and physiology. So knowing all the things that make up the human body and also how it works. You're constantly going to be learning new things when you're a nurse. I have not figured it all out. I've been a nurse for only 5 years, and there are nurses that have been working at my hospital for 30 years. I can't even imagine that. And they're saying that they're still learning new things. We're still discovering new things. Don't ever lose your sense of curiosity. It's going to make you a better nurse. It's going to make you take care of your patients better because you're going to be more knowledgeable about how things work. I feel like you should be a very ethical person, that you should be somebody that lives with integrity and honesty. You're going to be dealing with legal documentation. You're going to be signing your name to everything that you do for your patients. I have known some nurses that have been dishonest with their charting and charted things ahead of time or said that they gave a medication when they did not because they just didn't want to do the work. Even when it's inconvenient, you should have a sense of right and wrong, a moral obligation to stand up and advocate for your patient. Are you somebody who is confident enough to stand up and do the right thing? Thirdly, I would say that it's important to have a sense of adaptability. I can't tell you how many times I've been like in the middle of my shift, things have been all planned out, things are going along, and then you're gonna hit a speed bump. Things are gonna change. You might need to deal with a lack of resources. You might be short a nurse, or you might be missing a machine completely, and you're gonna have to figure out how to work through that speed bump. Sometimes I feel like I have to MacGyver things. I'm gonna save this patient's life with a pair of rubber gloves, some paper clips, and a magic marker. You need to be able to just roll with the punches. Float like a butterfly, sting like a bee. Okay, things did not go the way I planned it to go, but I need to have it just roll off my back. Let's take a deep breath and start again. Fourth, I would say having an organized mind, a mind that can be very razor focused on what's going on, but also see the big picture. You have to sort of be living in two different mindsets, back and forth. And this is something that will develop over time, is having that critical thinking skills, that way of coordinating care and prioritizing who needs my attention more, what needs my attention more. If you are just not organized and kind of just sloppy, your work is going to be sloppy. Things are going to fall through the cracks, and that can really affect your patients. Finally, this is the most important thing, but I would say compassion. The definition of compassion is that you have a sense of empathy to the point where you want to alleviate the suffering that you're witnessing. And that's what nurses do, is we alleviate suffering, and we are responsible for keeping patients safe and comfortable as much as we possibly can. Some patients, I see them on the worst days of their lives. If I could be just the bright spot for them, the little teeny bright spot for them, I feel like I really did my job. And compassion should just emanate from everything that you do. How you speak to people, how you give that healing physical touch to people, even just your general attitude. Yes, a nursing career is very, very difficult, but what I found is that things that are usually easy don't have as great a reward as things that are difficult. So if you have these attributes and you have a gut feeling that you want to become a nurse, I say go for it. Don't let people that have had just a stressful day discourage you from having a very rewarding career. So I plan on doing more videos in this Nurse Life series, talking about things that nurses deal with, or just things about nursing in general. And if you're a nurse yourself, please add to this conversation. You can give some advice to Amanda and those like her down below. I'm Musical Nurse. I'll see you guys next week. Bye!